Are you experiencing high rate renewals again this year? Many employers today are finding that their healthcare plans are increasing 10, 15, and 20%. This has been happening year after year, and it's time employers need to look at alternative or creative benefit solutions. My name is Shelby Denick, and I'm from Cambridge Employee Benefits. I'd like to talk with you today about creative benefit solutions for you and your employees. There are 3 options available that are very attractive today, and many employers are considering them and implementing them with the upcoming plan year renewals. Health savings accounts are a new option available, recently approved by the IRS in the past few years. Health reimbursement arrangements have taken on a lot of steam in the last few years, and we're finding a lot of new solutions to those programs. And finally, the new buzzword, incentive-based wellness programs, are coming to light and becoming more and more prevalent in the workplace today. Health savings accounts, or HSAs as many of you may refer to them, are actually 2 components. There's a high deductible health plan that you would purchase from your healthcare provider, just like the one that you buy today, your traditional plan. Many of these plans use the same PPO network that your employees are used to today. High deductible health plans are attractive because the premiums are significantly less than a traditional plan. Employers will purchase these plans and then offer them to employees at a reduced cost as well. The second component to an HSA is the personal care account, or the HSA portion of the plan. Employees can set aside dollars pre-tax and use those dollars at their discretion. This gives them the ability to control their health care costs. Employees today don't go out and buy a dishwasher or a car. Many of them don't even purchase groceries without knowing exactly what the price is going to be before they leave the store. Many of us don't even know what our treatment costs are until we actually get a bill or an explanation of benefits from our healthcare provider. We need to change that mindset, and in allowing employees to have more control over that through an HSA plan, for example, will help to educate them on what those true costs are and to be better consumers. Health reimbursement accounts or arrangements, or HRAs, is another option available. HRAs allow the employer to have more control over those extra dollars. Many of you may be familiar with HRAs because in the past we've purchased high deductible plans and then self-funded a portion of that. This option is becoming popular again today to help reduce those premiums that we're all seeing increase on a regular basis. When you self-fund the portion or all of the deductible for an employee, you are able to control exactly what that deductible level is. Employees will see a plan as however you want to write that plan, but you, the employer, have control over purchasing a very high deductible plan and then funding only when those services are being utilized. Finally, the new programs that are available today, incentive-based wellness programs, utilizes these same concepts through an HRA or an HSA that we see today, but it allows the employer to promote a healthy lifestyle for not only their employees, but their family members as well. When you incorporate wellness programs into your healthcare program, you're promoting these healthy lifestyles, helping employees reduce risk factors that in the end cost healthcare dollars and premiums to rise significantly. This program may not offer you the short-term solution that you're looking for in premium savings, but in the long term it will help change our healthcare trends that we see today. Incentive-based wellness programs use the same concept very similar to an HRA or an HSA. You can purchase a high deductible health plan from a health insurance carrier and then incent your employee to pass certain wellness factors or points in your healthcare program in order to achieve a lower deductible level. So for example, with an employee that may want to take a health risk assessment through their health insurance company online, you may say, we'll give you $25 to complete that health risk assessment and help identify health risk factors. That will help reduce their deductible by $25 for the next year. Maybe if you set up a smoking cessation program for your employee population, and if they successfully stop smoking, they may be eligible for $50 or $100 discount off their deductible. There are so many options available today in the healthcare market and so many options available as an employer. Programs can be customized today to help meet the needs of you, the employer, as well as your employee population. One of the most important things to take the time to do is to educate your employees, giving them a historical perspective of where healthcare costs have come from and what you, the employer, are paying to fund their program is important today. While many of our employees are aware of healthcare benefits and programs and costs because of what's occurring in our local and national economy and what we're seeing in the media, it is still important for them to understand what you, the employer, are paying for their benefits. Many employees have no idea what the total premium dollars are for their healthcare plan. While they feel they might be spending a lot of money out of their pocket to have healthcare, many of them are shocked to find out what the true cost of a healthcare premium is. Take the time and explain to them what those costs are. In 2009, it's projected that the average annual cost for an employee to have healthcare is over $9,000. Many employees only spend between $500 and $1,000 through payroll contributions to have their healthcare plan. Many of those same employees typically use $10,000, $15,000, or $20,000 in benefit and have no idea. As I mentioned before, most employees have no idea what they spend on their healthcare plan. They don't realize what the premium dollars are, nor do they realize what their claim costs are. A typical outpatient surgery today costs $5,000 to $7,000. The average cost for a brand name prescription is well over $100. Most employees are paying $20, $30, or $40 copays for their prescriptions and think that's exorbitant. Take the time to do some benchmarking, to review the data, and share that with the employees. Them having a better understanding and knowledge base of what their actual costs are will allow you to do the right thing with your healthcare plan. Employees will have a better appreciation for the benefits that are available to them by their employer. Employees will be able to make a better decision for their health care costs for the family. And at open enrollment time, cost increases won't be a huge shock for them. Communicating changes in benefits, trends, what we see in the marketplace throughout the year with the employees is very important. If you're planning on making a significant change in your health care plan, moving from a traditional healthcare plan to a HSA or an incentive-based wellness program, take the time well before open enrollment to educate them on these benefits. It won't be a shock at open enrollment when they see that costs have gone up or that they have to completely change their thought process or philosophy with regards to healthcare. Employees will understand and be able to make a better decision for their family. And you'll be in a better position because you won't have the employees worried about their healthcare expenses. If you're interested in learning more about these programs and looking at creative benefit options for your employees, please contact Michigan Assisted Living Association and they will put you in contact with our office. Or you can contact us directly at Cambridge Employee Benefits. Our phone number is area code 248-743-4300. Thank you.